Let's talk about the Symmetrylyft. This is
Okay.
something that you and I have been working on for the last few years. Tell me your perspective on the Symmetrylyft and what it means to you.
Yes, the Symmetrylyft has kind of metamorphosized from just the idea of doing combination treatments, because I think when you can do one treatment with, say, just filler, you get a level of effect, but when you do a combined treatment, I think you get the most benefit. So combining the filler and threads for a lifting effect gives a great overall result. What do you think? What's your kind of ideas?
I would say that, when I kind of break it down with filler, when we're doing a Symmetrylyft, we're really doing filler in two ways, and this is really part of the evolution, not just us, but among the world of injectors.
Yeah.
We're doing deep structural filler,
Correct.
which really kind of recreates bone, because as we age, our bony skeleton changes. So to me, the Symmetrylyft is a combination of deep structural filler, and then more surface, subcutaneous filler for like the tear trough, around the mouth and the lips. Also involving the forehead. A lot of people kind of ignore the forehead, but as we age, we lose volume everywhere.
Right.
So deep structure and surface filler is part of it. And then we, by using PDO threads, suspensory PDO threads added to that, seems to make a huge difference for our patients.
Absolutely. Yes, I mean, you just brought up a good point about the aging process, and I like the studies where they take a CAT scan and they look at a child and then a young adult and then adult and then an elderly person, and how the skull actually changes, how the orbits change. And one of the first areas you see aging is in the eyes, because people you lose that volume. You have depression of the fat pads, and you change the shape of the orbits of the eye. So that's one of the areas that I really like to treat, is around the eye, where you can restore that volume loss.
When we do the Symmetrylyft, it's not a one and done.
Right.
We typically schedule people to have this done over 3 to 5 sessions, a few weeks apart.
Correct.
And the idea is that you're gradually building volume, you're filling in areas of deficit, you're lifting and tightening, but not in one fell swoop. You have to give the tissue time to accommodate that filler.
Right.
Then you bring people back a couple weeks later, do it again, typically with less volume, fewer threads, a couple weeks later a little bit more, and then finally bring people in for a soft landing and to produce a very meaningful,
right, you
but
can
subtle
still get
effect.
a transformational result doing it that way, instead of doing one huge treatment at one time.
Because we hear that from a lot of our patients too. They're like, I don't want you to change the way I look, or I don't want people to know. Or one of the ways for people not to know is by doing things gradually. I think it's a great strategy.
Right, I do too.